I see too many people every year who tell me the same thing. I had no idea my kidneys were struggling. And that's exactly why I'm making this video. Kidney disease doesn't usually announce itself loudly. It whispers. And if you don't know what to listen for, you can miss it until real damage is already done. Let me ask you something before we go any further. Have you noticed any strange changes in your body lately that you've been brushing off as stress, age, or just one of those things? If so, tell me in the comments below what you've noticed, because awareness is the first step toward protecting your health. I want to be very clear with you right now. Your kidneys are not optional organs. They filter your blood, balance your fluids, regulate electrolytes, support blood pressure, and help keep your bones and blood healthy. When your kidneys start to fail, your entire body feels it, often in ways you wouldn't expect. And what worries me most is how often the early warning signs are ignored. One of the first things I want you to pay attention to is fatigue that doesn't make sense. I'm not talking about being tired after a long day. I'm talking about a deep, persistent exhaustion that doesn't improve with rest. When your kidneys aren't filtering waste efficiently, toxins build up in your blood. That toxic load directly affects your muscles and brain, leaving you feeling drained, foggy, and unmotivated. If you're constantly tired for no clear reason, your kidneys may be quietly struggling. Another sign I see people dismiss all the time is changes in urination. Your kidneys make urine, so when something changes there, it matters. You might notice you're urinating more often at night, or much less during the day. Your urine may appear foamy, which can be a sign of protein leaking through damaged filters. You may see darker urine, or even blood. None of these changes should ever be ignored. Your body is trying to communicate with you. Let's talk about swelling, because this one is especially important. When the kidneys can't remove excess sodium and fluid, that fluid has to go somewhere. It often shows up as swelling in the ankles, feet, legs, hands, or even around the eyes. I've had patients tell me, "I thought it was just salt," or "I thought it was the heat." Persistent swelling is not normal, and it's not something to wait out. Shortness of breath is another warning sign that surprises people. There are two main reasons kidney disease can cause this. First, excess fluid can accumulate in the lungs. Second, kidney disease can lead to anemia, meaning your body isn't producing enough healthy red blood cells to carry oxygen efficiently. If you feel winded doing things that used to be easy, your kidneys could be involved. Now let me talk about something people are often embarrassed to mention: changes in skin and itching. Healthy kidneys remove waste products that would otherwise irritate your tissues. When they don't, waste builds up and can cause intense itching, dry skin, or a grayish or yellowish tone to the skin. This isn't just a cosmetic issue. It's a metabolic signal that your body is out of balance. Another red flag I want you to take seriously is persistent nausea or loss of appetite. When toxins accumulate in the blood, your digestive system feels it. Food may suddenly taste metallic or unpleasant. You might feel nauseated without an obvious cause, or feel full after only a few bites. These are not random symptoms. They're signs your body is having trouble clearing waste. Let's talk about muscle cramps, especially at night. Your kidneys help maintain proper levels of minerals like calcium, potassium, and phosphorus. When those levels are off, your muscles can cramp, twitch, or feel weak. People often blame dehydration or exercise, but ongoing cramps deserve a closer look. Another subtle but serious sign is trouble concentrating or feeling mentally off. When waste products build up in the bloodstream, they affect the brain. I've had patients describe it as brain fog, forgetfulness, or difficulty focusing. This isn't just stress, it's chemistry, and it matters. High blood pressure is both a cause and a consequence of kidney disease, and this relationship is dangerous. Damaged kidneys struggle to regulate blood pressure, and high blood pressure further damages kidney tissue. If your blood pressure is rising despite treatment, or if it's been uncontrolled for years, your kidneys need to be evaluated. One more sign I never want you to ignore is persistent pain or pressure in the lower back or sides, especially if it's accompanied by fever or urinary changes. While not all kidney disease causes pain, infections, stones, or obstruction, they absolutely can. Pain is a signal, not an inconvenience. Here's what I want you to understand deeply. Kidney disease often progresses silently. You can lose a significant amount of kidney function before you feel sick. That's why waiting for severe symptoms is a mistake. Early detection changes everything. It can slow progression, prevent complications, and in many cases, preserve kidney function for years or even decades. I also want to be honest with you about risk factors. Diabetes, high blood pressure, obesity, smoking, frequent use of pain medications, family history, and dehydration all increase your risk. If you recognize yourself in that list, this conversation is especially for you. Now let me give you something practical. If you're noticing one or more of these signs, don't panic, but don't ignore them either. Ask for simple blood and urine tests. These tests can reveal kidney stress long before permanent damage occurs. Knowledge gives you power, and power gives you options. I believe strongly that most people want to take care of their health, but they need clear information and timely action. Your kidneys work for you every minute of every day. They deserve your attention before they're in crisis. If this video helped you understand your body a little better, I want you to share it with someone you care about. Kidney disease affects millions of people worldwide, and many of them don't know it yet. One conversation can change a life. And before you go, tell me in the comments, which of these warning signs surprised you the most? Awareness starts with a single moment of attention, and that moment could be right now.